and I'm the CEO of Encompass Health Rehabilitation Hospital of Miami. And today I have the pleasure of having Kira and Mark here. Kira, if you would like to introduce yourself.
Good afternoon. My name is Kira Stadnick. I'm the Business Development Director for Encompass Health Rehab Hospital, Miami.
Mark.
And I'm Mark Orm, the Director of Case Management here at the Encompass Rehabilitation Hospital of Miami.
Now, Mark, Kira and I have had the pleasure of being here before, and I know this is your first time. So would you elaborate on what a Director of Case Management is and how they help our community?
So as the Director of Case Management, I oversee the case managers within our hospital. And the case managers are primarily tasked with assisting patients with getting back to the community, getting back home. So we're assisting them with ordering DME, which is durable medical equipment, whether it be a walker, wheelchair, bed. We're also assisting them with either home health care, sometimes giving them the prescriptions for outpatient therapy if they have to continue their physical and occupational therapy, and even speech in the community. We're assisting them with getting all those things set up.
What made you want to be a Director of Case Management? I can't say, most kids grow up and say, that's what I want to do someday. What led you to this?
I honestly kind of fell into this position, in this role. I'm a social worker by trade. My brother was born with spina bifida, so we were in and out of the hospital a lot when he was younger. And having that hospital experience from the family patient side, it kind of helped cue me towards moving into this realm for hospital social work. Once I got in, I kind of just stepped up and became a supervisor and then ultimately a director.
Very impressive. So, today I want to take the time to educate the community on the services we provide, specifically around community admissions and discharges. For most patients and most family members, they believe that if someone gets sick, you have to go to the ER, right? Or outpatient or urgent care. But there's so many other resources, and Encompass Health, we have those resources available to help those patients and family members. And Kira, what does a community admission look like? And I guess what classifies as a community admission?
So a community admission is in the name. It's a patient that we do admit from the community. And we do have a lot of avenues that we can admit patients from the community. So if a patient lives at home, if a patient resides in an ALF, if a patient's at home and they're active with home health care, if a patient resides at a skilled nursing facility, or a patient that sees a physician in the community, or if they go to the ED, as you talked on earlier, we're able to take those patients without them having to go to a hospital per se. So if we have somebody who's at home, they have weakness, they're considering going to the ED, they don't quite meet criteria for an inpatient hospitalization, that's a great candidate for us to be able to capture in the community.
So how would they get a hold of us? If, for example, a patient family member says their loved one is feeling ill, under the weather, they start to get weak, and they're not sure what's going on, how would they get a hold of our services?
Right, so I believe we have our contact information listed on the board here. The best thing would be to contact one of our admission liaisons by calling our admissions number, which is 305-259-6494, and we'd have someone that'd go out to the home.
You have that memorized?
I do.
That's impressive.
We'd have someone come out to the home or the doctor's office or the hospital that they're at if they're in the emergency department and evaluate them. We are active in the community, so we do have a lot of community relationships, especially with home health care agencies. A lot of them are familiar with our services, so they can always ask a question to maybe their home health care representative that comes to the house or a nurse, and they should have some information on us as well.
And I know if they're unsure of, if they meet criteria to come to acute rehab versus going to the ER or urgent care, we send our liaisons there to do an evaluation of them and really see what's the right level of care for them. Could you talk through what that type of evaluation looks like?
Right, so we have a clinical liaison that does go out into the home. So if there's a family member or a patient that's having some type of weakness at home, they've had recurrent hospitalizations, they're falling, they're having some issues managing their medication, a family member's noticing that they're requiring to go to a house more to visit a family member or a loved one. Those are all the type of patients that we try to look to bring into our hospital from the community. The best way to go about that is you can have a conversation with the patient, maybe see how they're feeling. If they do notice that they need a different level of care or they're not getting the same level of care that they're getting from their home health care agency, maybe they need a few more visits, they definitely would want to contact us so we could send a liaison out. We do same-day admissions as well, so this is not something that has to be pre-planned. It's something that could be done within the matter of an hour or 2 hours. We provide transportation for the patients to get to our hospital as well.
And I know once they get here, we have the medical oversight to be able to really help them and, get them to where they're at a higher functional level so their quality of life gets better. And, from a medical oversight standpoint, we have multiple different specialties that would be able to take care of those patients. So, I'm proud of what the team here does. I think we really do make a positive impact. Mark, I know, your team has the job of getting the patients home safely. And I know you said that, your goal is always to send them back to the community. Talk me through that. What does that look like? What does a community discharge look like from start to finish when they get in through our front doors?
So for us, of course, the discharge process, we say starts day one. So when an individual comes in, we're going and we're doing our initial assessment. That assessment is going to find out where they're coming in from, if they had any equipment at home, if they had any services at home prior to, do they have any help at home? What does the home look like in terms of multiple stories? Do they have multiple steps? So that we want to gather all that information, because while you're here in the hospital, we do what's called team. So in team, we will meet with the rehab doctor, the physical therapist, occupational therapist, speech therapist, nursing staff, as well as the case manager, so that everybody can come together as a team so that we can see what's going to be the best outcome for the patient.
Now, what does acute rehab mean to you?
So acute rehab is typically a short stay, but it's intense therapy. So when you come in, you're going to get that 3 hours of therapy each day, but you're looking at a shorter stay. So anywhere from 12 to 14 days on average, of course, depending on the diagnosis that brings you into the hospital.
Now, with your background as a social worker as well, I know you've seen both sides of this, right? So if a patient, and kind of what Kira touched on, if a patient and family member is unsure if they should come to an acute rehab hospital or if they should go to the ER or urgent care or even their primary care, what would you tell those patients and family members to really look out for?
The first thing is you want to kind of look at like the history and why they're questioning things, why they think they might need assistance. When you come into our facility, one of the things we're going to do when we do our initial assessment, we're also going to talk to the families about trying to have some family training. So a lot of times the patients come in, we want to have that family training with the therapist so that they can see this is where they were in the beginning, this is where they've gotten to, this is how you can assist them.
What do you do during the family training?
So they will work primarily with physical therapists and occupational therapists, and they'll go over your ADL, so your average daily living, different activities. This is how you would put your socks on. This is how you can assist them getting up and out of the bed. This is how you can assist them with getting dressed, and or show that this is what the patient can do. So then the families are like, oh, I can't take them because they can't do anything. They can actually see all that the patients can do for themselves.
Thank you for educating everyone about that. I think it can be confusing, especially when your loved one is sick. You're not sure what to do, right? And when in doubt, you're always advised to call 911. But it's nice that the community has so many other options as well. What does a length of stay look like for a patient that comes to our hospital, Kira? What's the average length of stay we see?
So Mark briefly touched on that. Patients are with us in between 7 to 14 days. I always like to say no more than 20. And we do have fast track programs available. So if we do have a patient who's more independent, doesn't require as much therapy as someone else would need, we could fast track them and we can have them in and out of the hospital between 5 to 6 days.
And I think, that's a great benefit to the community because it's that intermediate length of stay, right? And it gets them out, especially with the holiday season. No one wants to be at a hospital during the holidays. So, with it being December 5th, if someone would benefit from our services, we can get them out with plenty of time to make it back home for Christmas.
Right.
So what does a case manager do, Mark? You touched on the different aspects of start to finish and making sure our patients are educated from day one, the families are educated from day one. But, case managers are kind of at the forefront of, they see the patient day one, and they're one of the last ones to see the patient and make sure they get home safely. Mm-hmm. But what's a day in and day out life of a case manager look like?
So we're kind of that go-to person. So the case managers are going to be talking with nursing staff. They're going to be talking with the internal medicine doctors. They're going to talk to the rehab doctors as well as the therapists so that they can find out exactly where the patients are. They're going to be talking with the patients so that they can see where they are and how comfortable they feel. But then they're also going to be reaching out and speaking to the families. So they're going to make sure the families are kept up to date, ask them if they need to come in for family training. We're also going to be there to assist you with some follow-up appointments once you're discharged. We'd like for you to get out to see your PCP, your primary care physician, within the first week. We're going to be doing follow-up calls once you actually do make it home, just to see how things were, to make sure that it's a smooth transition. So that case manager is that one person that you always have to contact.
Now, how does all of this help the patient and family prepare for discharge? Coming into a hospital setting and being a patient family member myself at times, it can be very confusing. And I know you talked through multiple different avenues that we do to assist them, but as a patient family member specifically, how do you help communicate with them day in and day out? Because that can be the toughest thing, right? You're at home, you don't know how your family member is doing. You want to make sure they're doing okay. You put the faith in the hospital that they're providing good care. But what tools do we have to be able to help the family members have that comfort level?
So being that point person, the biggest thing is you have one person that you can go back to have all of your communication through. We also have an app that family members are able to log into, so you can kind of track how things are going, that they're taking their medications, how they're doing in therapy. You have those extra things, so as a family member may not physically be here, but you're able to still look on the app and see how your patient or loved one is doing.
And that's great, especially during, again, the holiday season. It's sometimes tough to balance having to take care of your loved one, but also getting things ready for Christmas, right? So this way you could still be in constant communication and know how they're doing.
Mm-hmm.
So when it comes to Encompass Health, Mark, I know you've been with the company for many years. Why Encompass Health?
So it's a nationwide company. Honestly, for me, when I first looked at it, it was because they have hospitals throughout the entire U.S. We have a number of different hospitals, and we're growing. We're adding about 10 hospitals, it seems, per year. So the hospital as a whole is just growing, leaps and bounds.
You're right, on that. Every 1 in 3 patients that need acute rehab services get it from an Encompass Health hospital. So you're absolutely right. We are an expert at what we do. And, I have very similar reasons on why I chose to work with Encompass Health, because truly does emphasize patient safety.
Mm-hmm.
And at the end of the day, that's why we're in it, to make sure we help patients get better.
Mm-hmm.
Kira, what about you? Why Encompass Health?
Well, aside from being, a leader in the industry, I do have a passion to help people. I fell into Encompass Health through an employee referral, and I just wanted to be a part of a team that was fast growing, a team that, you could grow within and have opportunities and continue to just help people.
I think us three can really talk through the different aspects of what it takes to provide care to a patient. From my standpoint as CEO to business development director to director of case management, I thought this was a great group to bring together, because start to finish, right? You're responsible for bringing in the patients. Mark, you're responsible for getting the patients home safely.
Mm-hmm.
So when it comes to length of stay, I know Kira talked about the average length of stay. How do we determine length of stay when they get here? I know that, that falls on your plate, along with, of course, myself and many of the physicians involved, therapists involved. But what goes into that when we're determining a patient's length of stay?
So a lot of it, we're going to look at the initial diagnosis that brought the person into the hospital. So that's going to be the first thing. And then we're going to use the guidance and the guidelines, of course, set by Medicare, and then whatever private insurance, if they have private insurance, would state. So depending on what the diagnosis is, insurance might say, okay, for this diagnosis, the average length of stay is going to be 12 days. So then our goal is to make sure that they progress in that 12-day period.
Now, Mark, why would a patient or family member consider an admission to Encompass Health versus going to a hospital or a doctor's office?
So when you go into the hospital, one, you're not going to get the therapy that you're actually going to get when you're in our facility. You're still going to have the medical oversight with having internal medicine there, as well as the rehab doctors. But the amount of therapy you're going to get and the gains that you're going to be able to make in a short period of time are going to be far better than any other facility.
I appreciate elaborating on that. Now, Kira, what are specific diagnoses that patients and family members should look for? Cough could be one of them. But and we may need to work her up after this as well. So,
Yeah, I'm sorry.
no, but what would patients and family members look at? What specific diagnosis? You touched on some decline in function. Anything else specific that they should look out for?
Well, I'm glad you asked, because it's not always limited to diagnosis. It could be someone that has pulmonary issues, like I'm experiencing right now. Someone who's had a recent hospitalization and they decided to go home and they realize they can't manage themselves at home. Anyone who might just be having weakness, they're having issues walking around the house. Someone who is so weak it's hard for them to get to the bathroom in the middle of the night. Things like that. It's not diagnosis specific. Yes, if a patient has had a stroke, if they've had a hip fracture or any type of major surgery, they would come from the hospital. But things that you would see from home would be more of a day in and day out. How are they being managed at home? Do they have any deficits? Are they being able to ambulate? Can they go back? Or are they declining from where they were before any type of illness had happened? So there's a lot of things to look for. But definitely the number one would be a decline in function, more management needed by the family or home health care agency, if there is, and just anyone who has some type of medical complexity, an acute illness that might have been exacerbated along with some type of functional decline.
And one of the great, actually now I need some water. One of the great benefits, we provide is that the family training, right? But, we recently added home evaluations as well. Mark, can you talk about what our home evaluation process looks like? Because, it can be concerning to patients and family members on, is their loved one ready to go back home? Are they safe? Especially like what Kira touched on, if they have an immediate decline in function, it can be tough. And, when you say it out loud, we're going to get them better in 7 to 14 days. That may seem very quick, especially if they have had a large decline. What does our home evaluation process look like?
So for us, we will send the patient as well as the therapist out to the home so that they can, one, evaluate the space, but then we can also have the patient do what they would normally do in their own environment. So how they're able to get upstairs, how they're able to get on and off of their couch, get on and off of their bed versus just doing things in the hospital. And we're allowed to either FaceTime or Zoom call family members that may not be in the area so that they can see if you have a loved one and you live in New York, but they're here in Florida, you're able to visually see how they can function in their own residence.
Now, when you talk about if they're living apart from each other and they're able to visually see, talk a little bit further on that. What does that look like? Because, it may be confusing to people as far as, we utilize, whether it's FaceTime, and we have so much technology to be able to help evaluate that. But what does it look like for that family member, say, if they're out of state and they want to make sure that their loved one's going back home safely because they've had that sharp decline?
So we can talk with them to find out, do you have an iPhone or do you have a Galaxy, to figure out which app we can use, whether it be FaceTime, WhatsApp, Zoom call, and then we can physically show the patient doing their own things in their own environment. So how they're able to get on and out or in and out of the chair. And we can video them so that family is able to see that live, so that they can see how the patients are actually doing in their own environment. So they can't say or have that fear, well, I'm not sure if they're going to be able to get up the stairs. They can physically see them getting up the stairs. Or I'm not sure if they're going to be able to get into the bathroom. They can actually see how they can get into the bathroom.
Thank you for elaborating on that.
Mm-hmm.
Now, Kira, when it comes to bringing in patients and having that comfort level that we are the choice for them, that they should come to Encompass Health, and they should come to an acute rehab hospital. It can be so confusing with the many options they have, with home health, with SNF.
Right.
Why acute rehab services versus SNF or home health?
I feel like acute rehab should always be considered primarily for patients because everyone does have some type of gain that they can work on, whether it's functional or whether it's a medical necessity. So we are one of the highest levels of care that somebody is going to get in the community. And a lot of times the word intensive that gets thrown around with therapy is a little scary. But again, it goes back to its individualized care. When you move on to a skilled nursing facility, you're going to somewhat miss out on that functional component part that you would get in an acute rehab facility where you're focused on the PT, which is physical therapy, OT is occupational therapy, and even speech therapy for some patients who do qualify for that. And then when you do look into the home health care realm, you are getting services, you are doing therapy at home. However, it's much more limited. The days are spread apart. It's not an everyday type of service, depending on the diagnosis. So when you do come to an inpatient rehab facility, you're getting all those components. And let's say you ultimately do want to discharge to a skilled nursing facility, or our level is too intensive, or you do want to get back home, we will definitely facilitate that need to get to you to where you need to be ultimately. But it's definitely something that everyone should aim to go to post any type of acute illness, any type of injury, any type of deficit that they might have functionally.
Now, you both seem very passionate about what you do. And again, like I highlighted, it starts with Kira's department, ends with Mark's department, and then all the other departments are in between, right? Mark, can you talk about the collaboration you have with the marketing team?
And so we will sit and we will talk about patients prior to them coming in, but then we also have follow-up while they're here, and then we can talk with them after they've gone home. So the benefit is, a marketing liaison can contact me and be like, well, this is the patient's situation, this is where they're coming from, what can we do for them? So that we can kind of give them real-time information that they can provide back to the patient and or family so they can kind of ease their mind with coming into our facility.
Now, Kira, how about the other way around? How do you utilize your relationships with case management to benefit the patients?
Well, we work very closely in all of our cases. If we have a particular patient that might have additional needs, such as medical equipment or a discharge plan, maybe someone needs help with rehoming or they need to get into an ALF, before we bring those patients in, that's definitely something we talk about with case management to make sure we have a game plan. Because as Mark said, discharge starts on day one. We don't want to hinder anyone's discharge plan. We want to maximize their time with us where they can focus on therapy and get the medical management that they need. So we'll reach out, we'll table, we'll speak to each other on how we can best meet the needs of the patients coming in for whatever type of concerns they might have, whether it's social, medical, follow-up appointments. So, a lot of times we think that we are enemies. Sometimes we are, but we work very closely together to meet the needs of those patients.
I can vouch for them. It's a competitiveness that
Yeah.
and ultimately it benefits the patient because they both take pride in what they do. And I'm lucky to work with both of you, and I've seen the excellent work you both do and that our teams do. And it makes me proud to see, because ultimately there's a patient at the end of every situation, right? And on that note, Mark, is there any patient stories that come to mind? Leave out the patient name, but is there any stories that come to mind as far as a win, a success, a positive outcome that's happened as of late?
I think of a patient who's come in after a heavy stroke, and the patient can be really down. The family can think that they're not going to make any gains. And by getting the therapy that they're getting, by the time they leave, they're actually able to get up or stand on their own. That's huge progress for a really heavy stroke. And we have had a number of those patients come through our facility.
That's amazing work. Kira, I remember, when relatively new to when I first met you, we had a patient that was from out of country. And again, this is where that friendly competitiveness comes in with you two. I know Kira brought this up to me, and I thought this patient would really benefit from our services, and so did our rehab physicians. So Kira helped bring the patient in, and I know, Mark, you helped discharge the patient. But Kira, can you talk through, patients like that? Some people may think, I'm here visiting from, it was, I believe, Jamaica, and how do I get back there? How would Encompass Health be able to help them with that? Not only their functional gains, but also getting them back home, even if it's out of state or out of country.
Right, and we do experience a lot of those patients because we live in a vacation area. We do have a lot of snowbirds come down. We have a lot of tourism here. If anyone does have an acute illness, again, if you have a stroke, if you have a slip and fall and you do end up in the hospital, or you don't make it to the hospital, you're in a family member's house, we definitely are able to work closely with the director of case management and our case management team to facilitate that. So just because you live somewhere else, it doesn't mean that you're not going to be eligible to benefit from the rehab that we do have to offer. We will facilitate, we will game plan, we will work with the physicians on getting patients cleared for flights. We will help with flights, we'll help with transportation. So it's not really limited. It's something that if you're in need, our hospital is here to help serve you.
Thank you for elaborating on that. Mark, I know we have about 3 minutes left. What would you like to say to the community or even our team at Encompass Health?
Honestly, for me, this is probably the best team that I've worked with. Not only the case managers, I will always put them above everyone else, but the therapists, the nursing staff, the things that we have been able to do for our patients, I haven't seen done anywhere else.
Thank you. Kira, what about you?
I urge the community to come to our facility and see what we have to offer. I know we're a well-known name, we're well-known in the community, but until you come in and really see what we have to offer, especially in regards to competitors that we have in the community, come and check us out. We have success stories on our wall. We do great things. We do great work with our patients. Come in for a tour, talk to someone in admissions. This might not be a time for a family member right now or a patient right now, but it's inevitable at some point you will have an experience where you need to get to our level of care. And the more you know, the more help that you have, the easier that transition is. So that's one thing that I do have to give. We have great employees who work with us, who give great tours. We have great equipment. Come and see what we have to offer.
When I first toured our facility, it amazed me as well. And there's so much equipment that it took me time to figure out what they even were, right? But that's why we have the experts that we do that are able to educate the patients and the families on it. And Kira, you do a great job with tours, and you've taught me many of the items that we have to offer our patients. I'm very proud of what our team does, and I appreciate both of your time. I really wanted to get the word out there in the community that we can have patients come in directly from the community to us. And again, it may be uncommon, but I think it's our jobs to make it more common, increase awareness for it, because not every patient needs to go to an acute inpatient hospital or urgent care or primary care. There's so many options available to them, and we just wanted to present one of the options that are available to them in our community in Miami specifically. So, thank you both for your time, and thank you, Miami Community News. I really appreciate this opportunity to talk to the community and really provide services and education on what we can help them with.